everybody, it's Liz
and Griff
with the Magic Valley Business Spotlight.
Presented by Refresh Marketing.
Today we are at
CPR, Physical Therapy, and Performance.
We're going to split the responsibilities because we're at 2 locations.
Check us out, follow us, and see what they have to offer.
Everybody, we are with Cade now, and we are inside on the first location, which is the Big Red Barn on Addison. Explain to us a little bit about this cool room with the AstroTurf and everything else.
Yes, so we've always been a physical therapy first business, and with our rebrand, we're now physical therapy and performance, and we wanted to bring something to the Magic Valley that added value to what wasn't already here. And so having athletes come in, develop, get stronger, faster, all that kind of stuff was kind of our vision of this, and grow our services because we know how to help people move better and all that good stuff.
Perfect. So what do you do for work here?
So I'm a physical therapist.
Okay.
And I come here and treat people on one side of the building and on this side too, but we have trainers that are over here helping people that use this as their gym membership or come in for personal training or do circuit classes or whatever we're offering.
Great. So explain to me a little bit about the difference between the circuit class and how that also can tie into the physical therapy part of it.
Yeah, so if people are doing circuit classes, they can pay for just come in for circuit classes or speed and agility work or powerlifting, Olympic lifting classes. But on top of that, you can also do a gym membership. We like the model of having a gym with physical therapy. So if someone gets hurt, whether it's here or somewhere else, hopefully it's not here,
Yeah.
they can come in and say, hey, we have a physical therapist to check you out right now. Do we need to do something about this? What can we do about it? Do I need to go see a doctor? That kind of stuff.
That's
so
great.
It's a good symbiotic relationship in terms of a gym and physical therapy.
So for the gym aspect, are they only allowed during business hours, or how does that work?
Yeah, so we're open from 6 a.m. to 7 p.m. right now. We're looking at expanding into weekend hours possibly, but for now it's 6 a.m. to 7 p.m. Come in, use the facilities, whatever you need. We got trainers here to make sure that you have a program to work on. They're here to watch you. I call it semi-personal training. So they're kind of watching everybody in the gym. Hey, you need to tuck your pelvis a little more, stand upright a little bit better when you're doing this lift, or hey, this looks a little too easy for you, let's make it a little harder, or hey, that's too hard, we need to back it down and do this, it's a little easier, we'll build up to that again. So it's very fluid and personalized.
So for a beginner like me, or for our guy over there, Griff, who's been working out for a long time, it's really personalized to each one of those.
Yes, it's tailored to your specific goals. We do a full assessment of body biometrics and what you want to get out of it so that you can do your recreational activity better, whatever that is, function with daily physical activities better, if that's what your goal is, pick up grandkids. It's the whole spectrum from playing with grandkids to throwing a javelin, whatever that is.
Making it up my stairs 3 floors and not
Exactly,
being out of breath, like that would be great. So, true, it's a thing. So, perfect. So what made you guys want to build this other location and bring in the gym aspect?
We have a lot of therapists and trainers who were very interested in doing this. We already had a smaller scale program of this running at our other facility, but we really were getting a lot of interest from more athletic populations, high school athletes, recreational athletes, CrossFit people, wanting something that was a little bit higher level and more intensity. And so we opened up this location to better meet that need in the community.
How long have you been a physical therapist?
I've been a physical therapist for almost 4 years now, and it's been great. I love it and see a lot of great people.
Do you have an injury per se that you like to work on more with people than others?
No, the reason I'm in orthopedic, outpatient, sports rehab type stuff is I get a lot of variety. So I see someone with a knee issue, with a shoulder issue, hip issue, ankle issue, and it's not the same thing all day long. My specialty is in vestibular rehab, so concussion and inner ear dizziness and rehabbing that stuff. So
Perfect. I
like
have a
doing
neck
that stuff
issue,
too.
so
yeah, there we go.
we'll be talking afterwards for sure.
Okay, sounds good.
So, final question.
Uh-huh.
What is your favorite thing about the Magic Valley?
My favorite thing about the Magic Valley, I am not from here, so being a transplant about 4 years ago, my favorite thing has been the sense of community that everyone shares here. A lot of people have these big visions of how do we make this place better for the people who live here and who are coming here, and I love that about this place.
That's great. Perfect. Well, let's get Griff going on a circuit and you can explain to
Cool.
him what to do.
Sounds good.
Thank you.
All right, Griff, so we got this whole circuit for you. We're gonna go through it not blazing fast because I wanna make sure we got good technique and form, and I'll kind of coach you on it as we go.
Awesome.
So to start, you're gonna pick this up, keep a stable core. So
Okay.
you're gonna keep your back up straight, and you're gonna pull this hand over hand and get it all the way back to you.
Okay.
So we're gonna start there, bring it up, stand up
Stable
nice and
core.
tall. There you go.
Like that?
You can bend forward at the hips a little bit.
How's that?
There you go. That looks good.
Okay, ready?
Yep. Go ahead and pull. Awesome. Cool. Let's come over to these steps over here.
All right.
So starting there, you're going to come down, counter swing with the arms as you come down, and jump up onto the step. There you go. Now here I want you to come down, land softly, but you're going to jump up as fast as you can to the next one.
Okay.
There you go. Good. And then hop back down again. Good. And we're coming over here. This one, you're going to squat down, pick this up, and you're going to toss it up high and have it land close to that circle there.
Okay.
Yep. And then a big throw. Good. Come and hit it there. Perfect. Bullseye. And then we're coming back over here. You're going to grab onto the bars there. Squat down, kind of same thing you did for the rope pull, and back it up. Awesome. Good. So there in that circuit, we got back,
Yep.
pulling. We got some power movements with the jumps, and then some power movements with the throws, and then legs backing up, getting the quads. And
Cade, thank you so much for having us. Thanks
Thank
for getting
you,
my
Griff.
heart pumping. What we're gonna do now is we're gonna go check out CPR's second location on North College, have a chat with Sutter, see what they've got going on. All right, now we're at CPR's second location off of College Road. Sutter, thank you so much for having us.
Absolutely. It's great to have you guys.
Absolutely. Now, so this is a little bit of a different environment than we were just at. We were at the barn off of Addison, and I got to take a look at the Performance Center.
Yeah.
And over here, I wanted to kind of get a feel for the rehabilitation side, the post-surgical. What do you guys specialize in?
Yeah, there's a lot of different avenues here. We do a lot of work screens for different companies that we're connected with so that we can bring potential employees in and kind of run them through what a day's work would look like and kind of educate them about lifting mechanics to prevent injuries. So for work comp injuries, kind of reducing that from the business side, but then also for the patient to not have to go through an injury and have to adjust what they love to do.
So it's proactive. It's not just
Proactive.
reactive.
Absolutely. So it's super proactive in terms of the work screening side of things here at this clinic, but we also have a lot more space and availability equipment-wise for a wide range of patient population for the post-surgical, for the young athlete, if they're not able to make it over to our performance side of things over at the barn. But then also we have another gym facility called the MOG, or the medically oriented gym, where we get to transition patients over there where they can kind of continue on with their therapeutic exercises with a sports and exercise specialist.
So here, the MOG is here. Is that what you call it at the barn as well?
So we don't call that the MOG over the barn. That's specific for the performance, high level athlete. A lot of space you could see with the lifting bars and the turf, so they could have agility sessions going on. Over at the MOG, it's a lot more equipment based, treadmills, new steps, the upper arm ergometer, kind of like this machine here, so that older adults can go in, they can kind of get checked out with their blood pressure, their weight management, and then go through an exercise program to continue to maintain their strength, and just an exercise physiologist is there to structure their program.
So exactly what I heard that I liked most about the idea was you have a physiologist walking with you, watching you every step of the way to make sure that you're continuing to build properly and safely.
Totally. That's exactly the idea. It keeps patients that maybe they have a high copay or something like that and they can't afford therapy, so we kind of get them in, get their pain under control, but then they get to a point where they're able to continue with just strengthening. And so instead of continuing with maybe some expensive therapy, they'll go and transition over to the MOG, where they can have those exercise physiologists there and able to continue with their strengthening programs to maintain their good health.
I love that. Now, Sutter, what is your position here?
So I'm a physical therapist here. I was hired on a year ago, just under a year ago, and I'm just kind of getting the lay of the land with the clinic, and then also I kind of specialize a little bit more. I have a passion in running, and then I just took a course in older adults and the modern management of older adults in terms of strength and power, balance, and then ways that translates into normal everyday lifting of being able to lift a laundry basket or being able to carry groceries up and down stairs if they live in a second-story apartment or something like that.
All right, Sutter, so do you have a specialty here, or do you get to do a little bit of everything?
Yeah, so I don't quite have a specialty yet. I have a passion kind of with running and running mechanics and working with triathletes and endurance athletes. That's just a passion of mine, but I don't quite have a specialty in that yet. But then I also just took a course in the modern management of the older adult, where we're working on kind of strength and power, the ability to stay upright, reducing fall risk, but then if you do have a fall, how can you stand back up, and also have enough strength to lift laundry baskets, carry grocery bags up and down stairs if you have a second-story apartment or anything like that. So, but I see a wide range of patients, from back pain, neck pain, shoulder injuries, post-surgical, and then I do have a couple younger athletes that are volleyball players, baseball players, overhead athletes, and some runners as well.
That's awesome. And just for fun, do you have a success story? Have you seen somebody come in maybe in a very difficult manner that has given you a visual of how it can be turned around using services like you offer here?
Oh, I have tons and tons of success stories in terms of with patients. That's kind of why I really enjoy it at CPR, is like, it is for the patient, and we're here to make sure that we're serving the community in the best way possible. Just being able to come alongside somebody and get them back to their most meaningful activity in their life. And so for some, it's being able to walk from their front house to the mailbox and back safely, especially in Twin Falls where it can get icy. I've had other patients come in that really were not a fan of exercise and movement, and this individual actually happened to be training for the nationals of a pickleball tournament. And it just so happened that he was on my schedule, and I love pickleball myself and been playing for years, and he was kind of a little timid about physical therapy at first, and he's like, I've got a month before nationals, and we got him up and running with his back pain to be able to play pickleball in nationals and compete.
Oh, really?
competitively.
So not just for fun, you got him back in the nationals?
Absolutely.
In a month?
Yep, in a
Holy
month.
cow.
Yeah, so and that's just his story, and so he was able to be super motivated, and as long as the patient's motivated, you can see success pretty quickly. So other times it depends on their situation. It takes a little bit longer, but his was a month, and he got back to nationals.
Good for him.
Yeah, it was
good for
exciting.
you guys being able to help in that. And then one thing I have to ask everybody, I enjoy to ask everybody, what's your favorite part of being here in the Magic Valley?
Oh, I absolutely love the community of Magic Valley. I love it more than anything. The people are nice, the weather's nice. You can get outside and you can go golf, you can mountain bike, you can run. Personally, I like triathlons, and so I get to do all of that stuff here in the Magic Valley.
Sutter, you're a crazy man. Triathlons are a lot of work.
Just slightly. So, but then alongside that, when I'm doing my training and stuff, like I can be on the Canyon Rim Trail and I get to see a patient, and then I get to say hi because it's a smaller, close-knit community. So I like that about the Magic Valley.
Awesome. Well, we love what you're doing for the Magic Valley. Thank you so much for having us and answering our questions.
Thank you
so much. We appreciate you guys.
Appreciate it.